Okay, hey there, welcome back to the deep dive. So glad you could hang out with us.
Good to be back.
We got this source material you sent over from Book Podcaster. It's a whole chapter, actually.
Yeah, it's some really important stuff.
Definitely. It tackles the huge influence of culture, spirituality, and, well, even the environment in pediatric care.
A big one. Absolutely vital for anyone going into healthcare, especially with kids and families. It just really shows health it's more than just biology, you know?
Totally. And look, we know you listening are probably, well, maybe you're deep in nursing school right now, feeling swamped.
Yeah, drowning in info, maybe.
Exactly. So think of this as us kind of like pulling the key notes for you, highlighting the really crucial bits.
We want to make this topic feel a bit less overwhelming, more actionable.
Right. Like, okay, this is what I really need to get.
Our mission today is just to walk through this material, pull out the core ideas about these influences, and how they really shape the care you'll be providing.
Makes sense. Getting to the heart of why it matters.
Exactly.
All right, so let's unpack this. Why is cultural competence such a big deal? I mean, is it just being nice?
Oh, it's way more than that. The source really hammers home how diverse the U.S. is. And it's getting more diverse all the time.
You're going to be caring for families from everywhere.
Right. With all sorts of beliefs and backgrounds. So providing care that actually, gets that. It isn't just a nice extra. It's fundamental for patient safety, for treatment actually working.
So it's about quality, clinical quality.
Totally. It directly impacts outcomes, how well the treatment goes, if the family feels okay with the care, if they trust you.
Yeah, if you miss this piece, things can really go sideways.
Exactly. And when you can provide care that considers their culture, their spiritual beliefs, values, traditions, their environment, you're actually removing barriers.
Makes care better, safer, more efficient even.
Yes. Better quality, better safety, better outcomes for the kid.
And the source says you got to look at the whole picture, right? Child, family, culture, beliefs, environment, all of it.
You can't just treat the diagnosis in a vacuum. And a really key point it makes is, well, to do this well, you have to look at yourself first.
Ah, okay. Self-awareness.
Yeah. As the nurse, you need to be aware of your own beliefs, your own potential biases, before you can even try to understand the patients or the families.
That makes total sense. Can't see clearly through their lens if yours is kind of smudged with assumptions you haven't even looked at.
And respect is key. Absolutely non-negotiable. But the source warns against stereotyping. Big time.
Right, because culture isn't a monolith.
Exactly. It gives a framework, sure.
Yeah.
But every family, every single person lives it out differently. And culture changes. Across generations even.
So learn the patterns, but always see the individual.
That's the core message. You got it.
Okay, so let's go a bit deeper on this culture thing and that self-awareness piece.
Well, the source describes culture as kind of a template for psychosocial needs.
Yeah.
Kids learn it from parents, caregivers, they model it, they teach it.
How to behave, view the world, view illness and health.
Crucially, yes. And that's where cultural bias can sneak in.
Which the material defines as putting your own values ahead of another culture's.
Right. And to stop that from messing up care, you have to do that self-check. Non-negotiable.
You don't have to agree with the beliefs.
But you must respect them. That's the bedrock.
So this self-awareness thing, it's not like a one-and-done checklist.
Not at all. The source calls it a journey, personal and professional,
Right.
something you work on your whole career.
Okay.
And it gives some really good, introspective questions to ask yourself. Things like, what do I believe about health? Am I familiar with care patterns in other cultures? How do I react?
What are my past experiences, good or bad? Am I really treating everyone respectfully?
Yeah, and have I asked caregivers for their input? How do I view other cultures, really? Do my values clash? Am I aware of my bias? How am I biased?
And what am I doing about it? Phew. Those are big questions.
They are, and the source suggests ways to build that awareness. Read stuff, take courses on implicit bias.
That Harvard Project implicit tool is mentioned too, right?
Yeah, that's a useful one.
Yeah.
Can definitely highlight biases we don't even realize we have.
And it comes back to culture being fluid, so maybe full competence isn't the goal. More like commitment to the journey.
Exactly. It's about ongoing learning. Always.
Okay. Now, the source brings up some key concepts here. Transcultural nursing.
Yes, that's basically the practice of intentionally weaving a patient's culture into their care plan. And it introduces Madeline Leininger. She's really the founder of this whole field.
Leininger, right. Her cultural care theory sounds like it looks at the person in their whole context, environment, community.
Precisely. Her theory really gets at how much culture impacts health. including stuff passed down for generations.
And her point is that a cultural assessment isn't just fluff, it's necessary data.
Essential data. It needs to be part of evaluating support and needs from that cultural and spiritual angle.
Yeah.
And then you use that info in the care plan.
Got it. Not an afterthought. Which ties into the next big topic, health disparities and social determinants.
It does. The source talks about the changing demographics of kids in the U.S. Cites 2020 data, increasing diversity.
Yeah, while white non-Hispanic is still a large group, you've got growing numbers of Hispanic, Black non-Hispanic, Asian non-Hispanic kids, kids of 2 or more races.
And these changes can bring health disparities into sharper focus.
Which the source defines as basically social or economic hurdles to good health for certain groups, based on race, religion, income, where you live, all sorts of factors.
Right. And building on that are the social determinants of health. These are the conditions where people are born, live, learn, work.
Like income, education, neighborhood safety, job situation, support networks, access to healthcare.
All that stuff. And here's the kicker, the statistic that really jumps out in the source.
Oh, yeah.
Social determinants factor into about 80% of patient health outcomes.
80. Wow. Okay, so that's huge. It's mostly not about the specific germ or disease.
It's overwhelmingly about the context of someone's life, their environment.
The food desert example they use really makes that clear.
Yeah. Low-income area, no grocery store with fresh food nearby. It's not just harder to eat healthy. Kids aren't even seeing it modeled.
It's not a personal failing, it's the system.
Yeah.
That environment directly impacts their health long term.
Exactly. Where you live deeply affects how you live, health-wise.
Okay, so knowing that, how do we actually work towards better outcomes? The source talks about strategies for equitable care.
Right. And first, it makes a clear distinction. Equality versus equity.
Equality is everyone gets the same thing, like same size shoes for everyone.
Right. Which doesn't work. Equity is giving everyone what they need to succeed. Shoes that actually fit. Or maybe a ramp to get into the store.
So strategies should aim for equity, tailored support, based on evidence.
Key ones mentioned are agency policies, family-centered care, and really looking at dietary needs.
Agency policies, like visitation rules, or what food the hospital provides.
Exactly. Sometimes those can clash with cultural or spiritual needs. The source suggests checking out policies before you take a job somewhere, if you can. Save stress later.
Smart. And family-centered care. That seems naturally aligned with this whole approach.
It really is, especially in PEDS. The source lists things like trying to keep things normal for the child, finding ways for them to play, letting caregivers stay overnight.
Making sure caregivers have space for hygiene, meals, unlimited access.
Yeah, letting them participate in the care, asking for their input, and really listening to what they say works for their child and family.
Listening again, it keeps coming up. And the diet stuff gets pretty specific, too.
Totally. Encouraging families to bring familiar foods from home. Checking restrictions, of course. Making sure hospital food is decent, offering special diets like kosher or halal. Having variety.
Documenting restrictions based on their wishes. It's about respect and comfort, not just calories.
Exactly. And the source also nods to staff education. Ongoing training, learning about the main cultural groups you serve.
Giving people tools and theories, like the ones we're talking about. Okay, let's shift to communication. That seems huge here.
Absolutely. Effective cross-cultural communication. It's complex. It's words, tone, body language, speed of talking.
All influenced by culture, relationships, how the listener takes it. You can mean well and still totally mess it up.
Yeah. The source contrasts the typical U.S. approach, direct questions, private setting, with what might work better in other cultures. You need awareness to adapt and get accurate info.
What are some best practices it lists?
Learn about different cultures. Figure out who makes the health decisions in the family. Ask how they see the cause of the illness that can vary a lot.
Consider if provider gender matters. Ask preferred language. Use a certified interpreter. That's a big one.
Huge. And make sure written stuff is easy to understand. Check literacy levels without making assumptions. Don't interrupt. Use the right tone. Give undivided attention.
And be aware of those subtle things, like silence or eye contact. Personal space, those mean different things everywhere.
Silence can mean so many things. Agreement, thinking, confusion, disagreement. You can't assume.
Okay. And body language and touch. Also tricky.
Definitely. Acceptable levels vary hugely. Direct eye contact. Maybe yes, maybe no. Head nodding could mean yes or just, I'm listening. Touching a child's head. Really sensitive in some cultures. Handshakes. Even hand gestures. Need to be mindful.
And building trust through all this, relationships based on respect.
Especially in PAIDs. The source lists best practices. Keep info confidential. Realize you're building a new relationship. Maintain boundaries.
Know your reporting duties for abuse neglect, which can get complicated with cultural practices sometimes.
Treat every patient as unique. Treat all patients equally. Keep relationships professional. Offer choices when you can.
It also mentions teamwork, right? Multidisciplinary relationship.
Yeah, sharing info, respecting different views, even if you disagree, supporting colleagues, always focusing on the patient, using ethics consults if things get really sticky.
And it acknowledges that nurses might feel uncomfortable sometimes, working with different cultures.
Right, it links that to the uncertainty, the mental effort of trying to understand. It's okay to feel challenged. The point is how you handle it, respectfully.
It's a sign of growth, not failure. Okay, a major source of that challenge: language barriers.
Defined simply as when communication just doesn't land right, leads to frustration, maybe anger for everyone.
Top advice:
Stay calm. Contact an interpreter. That's number one.
stay calm, get help. Okay, then what?
Use appropriate body language if you're sure it's okay culturally. Avoid random gestures. Let parents stay if it helps. Maybe use touch or facial expressions for concern. It's appropriate. Pictures can be a temporary fix till the interpreter gets there.
Pointing at pictures for immediate needs, maybe? Using basic online translation very carefully.
Yeah, for super basic stuff. But the source is clear. Don't do elective procedures without proper consent via a certified interpreter. Absolutely not.
Makes sense. And working with interpreters.
Don't play charades while waiting. Pictures are temporary. Family might interpret, but certified is always better. They're trained, neutral.
Document the interpreter's name and ID. Services are free to the patient. Use them for teaching, consents.
And always talk to the patient or family, not the interpreter. Keep eye contact with them.
Services for deaf patients, too, should be available. Know your facility's resources.
Right. What tools do they have?
Yeah.
Phone lines, video services, language lists. Be prepared.
All this ties back to how culture shapes behavior. People act how they're taught. Kids might even pretend to respond how they think they should.
Yeah, instead of saying how they really feel. Which is tough, because safe care depends on getting the real story.
Especially for things like medical history, symptom description, things that might feel embarrassing or shameful depending on the culture.
Right. So the source loops back to those key areas influenced by culture.
Personal space, eye contact.
Diet, again, thinking about kids' lack of control at home, cost of healthy food, comfort foods, meal times, parents eating with them, even needing fridge space.
Time perception clashes with schedules, need for prayer time, touch again, huge variations.
And alternative medicine comes up again. Herbs, home remedies.
Need to know about them for interactions. Respect them if they're not harmful. Discuss with the team. Family leader influence too.
That balance. Respect, but safety first. Always discuss.
Which brings us to actually doing the assessments. Cultural and spiritual assessments.
Right. Cultural assessment. Gathering subjective info on beliefs, values. Purpose is to show interest, individualize care, weave it into the whole picture.
But it often gets put last on the list, right? Seen as less important.
Unfortunately, yeah. But the source says it must evaluate things like religious beliefs, how the family sees the illness, food preferences, daily schedule.
And nurses should be asking, interpreter needed, preferred language. Who decides health stuff? Will this treatment clash with beliefs? Need a spiritual leader.
And some direct questions from the source. What culture do you belong to? How important are your beliefs here? Having trouble meeting health needs due to beliefs? Got community support.
The Geiger and David Hazar model is mentioned as a tool.
Yeah, a framework to make sure you cover key areas. Communication, space, biological variations, time, environmental control beliefs, social structures like family. Helps broaden your thinking.
And family means?
Whoever the child and caregiver say is family, not just blood or legal ties, though you still need the legal guardian for consent.
Got it. Then spirituality, belief in a higher power affecting life.
Concepts of origin, afterlife. Religion is common, but you can be spiritual without it. Everyone's unique.
Core message again, respect, be aware, adapt care. Get info from reliable sources, especially the family.
And the source gives a practical tool for this. FICA.
FICA. Okay, what's that stand for?
F is faith, belief, meaning. I is importance, influence. C is community. A is address or action and care.
So what's your faith? How important is it? Are you part of a community? How do you want us to address this in your care?
Exactly. It helps get baseline info, tailor care, spot spiritual distress, bring in chaplains maybe, and let the family tell you in your own words what matters.
Understand their viewpoint. Makes sense. Okay, last big piece. Environmental factors. Huge impact.
Massive. Home environment affects care delivery, food, med storage, privacy. For kids' assessment, think about who's in the family, income, parent jobs, safe places to play outside.
Environmental hazards, lead paint, bad water, access to ER or police, nearby industry, trauma center access.
All those things. And the source admits doing these deep assessments, it's tough. Time, maybe knowledge gaps about specific groups, funding.
It mentions a study in pediatric oncology showing the need for spiritual support is there, but how best to do it is still being figured out.
Right. Need is clear, best practices still evolving.
Okay, to make this all less abstract, the source has a case study. Kathleen, 10 years old.
Yeah, pulls it all together. She's hospitalized, different culture. Keeps asking for mom, but mom's visits are unpredictable.
And there's conflict. Late night visitors, friends keep waking her up. Plus, mom wants her to eat specific cultural food with her when she visits, messing with hospital meal times. And the visitation policy is strict. Parents 24/7, others only 8 a.m. to 8 p.m.
You see all the layers immediately. Communication issues, cultural norms clashing with policy, time differences, diet conflicts, real-life messiness.
Exactly. So the source asks, how would you handle the visitor thing? What are the obstacles to good care here based on what we've talked about? How do you tackle that visitation policy clash?
Okay, the visitors. Yeah, you can't just quote policy. Need to understand why they're there. Spiritual support, community obligation. Frame it around Kathleen's need for rest, maybe. Acknowledge their importance, but suggest different times.
Right. And the obstacles. Definitely communication. Interpreter needed. Does mom get the policy rationale? Time perception differences. Dietary conflicts. Is the hospital food awful or just unfamiliar?
And that visitation policy, that's where it gets tricky. Does it have any flex? Can you advocate for an exception? If not, how do you compromise? Find a way to respect the visitors and Kathleen's rest. Maybe quiet visits. Needs creativity.
Yeah, it really pushes you to use everything. Your own self-awareness about maybe feeling frustrated, your communication skills, your cultural knowledge or willingness to find it out, problem solving within the system.
This case study really shows why this stuff isn't just theory. It's bread and butter nursing practice. Assessment, communication, cultural differences, policy challenges, all rolled into one.
Brings it all home.
Definitely.
Wow. Okay. We have covered a lot of ground. Communication, self-awareness, beliefs, policies, social determinants. It's definitely complex.
It absolutely is, but it's so foundational for safe care, effective care, truly compassionate care, especially for kids and families.
And for you listening, maybe in nursing school, just trying to absorb all this, knowing that this kind of care isn't just a line item, it's this dynamic, ongoing thing. Just engaging with this, that's huge. Recognizing the complexity is the first step.
It takes practice, applying it every time, every assessment, but diving in like this shows you're committed to seeing the whole person, the whole family.
You've got this. Seriously. It's challenging stuff, but every bit you learn makes you better, more empathetic, more effective. Maybe just pick one thing from this conversation.
Yeah, like maybe remembering to talk to the patient when using an interpreter, or asking about their view of what caused the illness.
Exactly. Just one small shift. It can make a huge difference.
And think about how learning these different perspectives, it doesn't just make you a better nurse. It genuinely makes your understanding of people, of humanity, richer.
Well said. Thanks for doing this deep dive with us today. Keep learning, keep going. You're heading towards really important work.